Hi friends, welcome to Safe Path Veterinary Services. We are going to start a video series for the preparation of veterinary officer's exam. This is our first video in which we are going to discuss about some basic terminologies of the veterinary anatomy. First of all, talking about the definition of veterinary anatomy, which refers to the study of form and structure of the body of an individual, including the form and structure of different systems, different organs of the body. If we talk about different branches, first of all, ontogeny, which refers to the study of developmental life history of an individual from fertilization to the death. Phylogeny, which refers to the development of an individual during different phases of evolution. You can say its resemblances with the ancestors and what kind of changes take place from its development from the prokaryotic life to the eukaryotic and its present form. Osteology, which refers to the study of bones and skeletal system. Myology, which refers to the study of muscles. Splanchnology, which refers to the study of visceral organs. Angiology, which is the study of cardiovascular and lymphatic system. Neurology, which is the study of nervous system. Anesthesiology, which is the study of sense organs and different structures. Nephrology, which is the study of kidney. Developmental anatomy, which is the study of successive developmental changes of individual from fertilization to the fully developed individual. Comparative anatomy, which is the study of comparison of anatomical features of an individual within the different species. Like we can say the comparison of skeletal system of different species and comparison of cardiovascular system of different species. Systemic anatomy, which is the study of different systems like the cardiovascular system, like the hepatic system, like the lymphatic system. Regional anatomy, which is the study of anatomical structures present in a particular region of the body. We can say we are going to study the regional anatomy of a limb. We are going to regional anatomy of the head region. Special anatomy, which is study of form and structure of particular species of an animal. Hepatology, which refers to the study of liver, gallbladder, pancreas. Anthrology or syndesmology, which refers to the study of joints or the articulations. Gastroenterology, which refers to the study of digestive system. Dermatology, the study of skin. Cardiology, the study of the heart. Hematology, which is the study of blood. Urology, which is the study of urinary system. All of these terms do not refer to the just to the normal studies of these systems or these organs or different conditions, but also with the treatment and the diagnosis and abnormal conditions of the systems. Some anatomical planes, the mid-sagittal and the median plane, which refer to imaginary rectangular object which divides the body of an individual along the longitudinal plane into equal right and left portions. Dorsal and frontal plane, which is perpendicular to the median, and transverse plane and divides the body into dorsal and ventral parts. And the transverse plane, which is the plane perpendicular to the median plane, dividing the body into cranial and caudal portions. The sagittal plane, which refers to the parallel plane to the median plane and divides the body into unequal right and left portions. Longitudinal and transverse sections, these are different sections which we take within an individual. The longitudinal section refers to the cut along the long axis of an organ or the limb or the body of an individual. It may be along the median plane, sagittal plane, or the frontal plane. And the transverse section, which is the cut along the transverse plane or the you can say transverse plane, transverse section of liver, transverse section of kidney. These terms refer to the transverse sections. Some descriptive terms, that is the dorsal, which refer to away from the ground, the part of the body which is away from the ground. Like we can say the vertebral column is dorsal to the abdomen, and we can say ventral, which is toward the ground. We can say abdomen is the ventral to the vertebral column. Cranial, which refer to the parts of the body toward the head, and the caudal, which refer to the part of body toward the tail. We can say the hind limbs are caudal, and the forelimbs are the cranial. Rostral, which refer to the part on the head which is closer to the nose, and you can say the eyes are rostral than the ears. And the palmar, which refers to the surface below proximal end of the corpus directed toward the ground, and plantar, a surface below proximal end of the dorsal directed toward the ground. Palmar refers to the forelimbs, and the plantar to refers to the hind limbs. Here you can say the different terms explained in the picture: the dorsal, rostral, caudal, ventral, cranial, dorsal, palmar, and plantar. Different terms are described in this picture on the animal. Medial, which refers to the toward to the body part which is toward median plane, and lateral, which refers to the body part which is away from the median plane. You can say the outer portion of the limb is the lateral side, and the internal side of the limb is the medial side. Proximal refers to the part of the body which is nearest to the trunk, or the point of the region. You can say the palm is distal, and the scapula is the proximal. And distal refers to the away from the trunk, like we have already referred that the palm refers to the distal. Superficial, which refers to the organ or part of the body which is toward the surface. You can, the skin is superficial. And deep, which is farther from the surface toward the center. We can say the bones are deep. Peripheral, which refers to the distant from the region near the surface. That is also, we can say, the peripheral blood supply, and different terms we use. Here we can say the terms are explained in the picture: superficial, deep, lateral, medial, and distal, and proximal. Axial, which refers to the axial and abaxial. These terms refer to relative position to the longitudinal axis of a limb. You can say closer to the longitudinal axis and away from the longitudinal axis. Closer to the longitudinal axis, which is axial, and away from the longitudinal axis, with the which is abaxial. External, closer to the outer surface of a structure. Internal, closer to the center of a structure. Supra, that is a prefix that signifies the term over, like we can say supraorbital. Infra, which is the prefix that signifies the below, like we can say the infraorbital. These are some terms. In this picture, you can say these terms are explained like axial and abaxial with respect to the longitudinal axis of the hoof.